Over the years, the improvement in knee replacement has come up. At present, we are using robotic. So robot is such a thing which is helping us in doing a knee replacement, not that it does the knee replacement by itself. It's very simple that what we tell the robot to do, it does, and it does a part of it. It does not do the whole thing. The robot has certain precisions. One is that there is less blood loss. It is a 100% precision surgery where human beings tend to make a mistake. Robot usually does not make a mistake unless we fed something wrong onto it. And third thing is that we can go through a smaller cut and patient recovers faster because there is less pain and less blood loss, because the alignment balance, which is the most important part of any mobility that is in the wheels or on the knees, is achieved with the help of robo. That's why we say that robo is there to stay, and we are using one of the best and the latest type of robo, which is a 4th generation robo. And this robo gives us both alignment, balance, and as well as precision cuts, and protects all the tissues. So this is one of the best robots that we are using, which is available in our hospital now.